Hello and welcome to this new lecture that we'll be discussing some important subject that's called the decay, missing, filling, and oral prevention. First of all, what is oral prevention? The answer to this question is that oral prevention is the science and clinical procedure that is used to prevent caries and oral abnormalities. In this clinical procedure, we can use the decay, missing, and filling, decay, missing, filling surfaces, and it is used also to measure the decay, missing, filling teeth. It is very well-known procedure and widely practiced in the world, and it is the most appropriate and scientific way to measure the teeth problems in the population. In this decay, missing, and filling index, we have a schedule, we have a number of teeth to be measured, and they are very important teeth and deciduous and permanent teeth. But we cannot use primary and permanent indication and write them at the same case sheet or at the same calculation paper. Therefore, we have to separate between the deciduous teeth and the permanent teeth. Even in patients having both primary and deciduous teeth, we have to first measure or record the deciduous and then record the primary teeth in a separate paper. Sometimes the caries are questionable, so we don't know if it's a cause of lesions or it is a cause of stain, or it is a cause of different problem with the tooth. Therefore, we should not record it as a decayed tooth and leave the place for the recording of the tooth empty. Some teeth are affected by trauma and avulsed and are missing. In this case, we don't record the tooth as a missing tooth, because the only teeth that will be recording on the decay, missing, filling paper are the teeth that are missing because of caries and not because of trauma or any orthodontic extraction or congenitally missing teeth. Teeth that are covered by a veneer for cosmetic purposes are not considered to be filling, not considered to be filled. Therefore, they should not be recorded as filling teeth. Otherwise, teeth that were filled and now are primary or secondary caries involved, we should record them as decayed. And temporary restoration for teeth is also recorded as decayed. When it comes to teeth that are covered by a crown or roots that are retained to be used as a future posts for pontic, to be used as a retainer for root that are retained, to be used as retainers for retainer, they are root that are retained to be used as a retainer for a new crown or crown that are fully overlying the tooth as a full restoration for badly carious teeth. They are recorded in both cases as five surfaces decays. Five surfaces decays, this is when it comes to posterior teeth. But when it comes to anterior teeth, we should record only four surfaces. And anterior teeth of the all teeth of the deciduous patients are 20 in number. Therefore, a decay missing filling teeth index is only 20. Primary teeth are 20. Primary teeth are 32. Therefore, decay missing filling teeth is 32. In fact, not 32, because we do not take the third molars in consideration. Therefore, that's right, the deciduous teeth is only 20, but the permanent teeth, they are 28. And the decay missing filling teeth index is also 28 in permanent teeth. That's for the DMFT. But when it comes to DMFS, in this case, for the primary teeth, the maximum score to be recorded is 88, and the maximum score for recording the permanent DMFS is 128. There is also gingival and plaque and calculus index, and in this index we must record the maximum record of teeth, also in decay, missing and filling surfaces. But in this case, we only take selective number of teeth, and we don't take the occlusal portion surface of the tooth. And the score maximum is 3 and minimum is 0. This one is different from the DMFS index because, first of all, it is a record of a selective few number of teeth, and the occlusal surface is not taken in consideration, and the maximum and minimum score is between 0 and 3. Plus, we have to take the first plaque index, then we take the gingival index, and last we take the calculus index in this sequence. And this concludes our lecture today, and it was a very nice lecture, I think. It needs some re-evaluation and revisiting, but it is very easy lecture and can be explained easily.